Okay.
Good afternoon, everyone. Thank you so much for everyone attending our ONEgeneration Health and Wellness Webinar Week. Thank you for everyone that's just been attending yesterday and this morning. And we're so excited that you're just taking the time out of your day just to attend and participate with us. My name is Niambi Cooper, and I'm the director of ONEgeneration Senior Enrichment Center, led by our organization's president and CEO, Jenna Haas. So this webinar layout will be composed of having our presentation first, and then we'll have our questions and answers at the end. But please feel free throughout the entire presentation to interact, to answer questions via the chat. And you can also use our Q&A box function at the bottom part of your screen in order to type in questions. And you can also, if you don't feel like typing in questions, you can just simply raise your hand, and I can allow for you to speak and ask the presenter a question verbally. I'm super excited just to introduce Monica here. She will be presenting on scan health benefits for 2021. So Monica, thank you so much for joining us today. And we're super excited to have you and just to hear more.
Thank you so much. Thank you for the opportunity to present these benefits to the audience. First, I want to give you some information about myself. And I am the person on the right-hand side, Monica Ibanez. And my partner, Eliana Zorrilla, is not with us today, but usually we do these conferences together, but it's just me today. As I said, my name is Monica Ibanez, and you can see my telephone number in case you have any questions. You can call me anytime. I also have my email address under Monica Ibanez at scanhealthplan.com. And then I also have a microsite that you can take it down and write it down. And then if you have any questions, you can go straight to my microsite. And the information we're sharing today, you can also go to the microsite and you see the same information that we're sharing today. Now I want to go to the next slide. Okay, I don't know why I need to do this one by one. Okay, before we begin, there are some things that you should know about me. I'm a state licensed representative working exclusively for SCAN. I'm an employee with SCAN Health Plan, and I joined SCAN 7 years ago. I do not represent the federal or the state government, and today we're going to be discussing SCAN's HMO plans. SCAN was founded over 40 years ago, and SCAN stands for Senior Care Action Network. It is a local company. It's headquartered in Long Beach, California, and it works as a nonprofit organization. We have received 4.5 stars by Medicare. This is very important to count the stars that every company receives on a yearly basis, because based on the stars, we receive money from the government. So we work exclusively for Medicare. Medicare comes from the government. So we had, SCAN has received 4.5 stars for 5 consecutive years. And we're looking forward to receiving another 4.5 now that we're heading into 2022. The more stars you receive, the more money we receive from the government. That means that we give better benefits to all of our members. We have received many awards and recognition. Like I mentioned, CMS 4.5 star rating. We are rated as a top insurance company in the country by US News and World Report, and we have excellent customer service as well. We have received 3 Stevie Gold Awards for excellent customer service to our members. Now, as you can see, SCAN offers different languages and interpretation. If you feel comfortable speaking your native language, you can call SCAN, and we're able to coordinate an interpreter or any kind of translation services for your convenience. Now I have a little bit of Medicare information. In order for you to qualify for Medicare, you need to be 65 years old, and you are responsible for paying some premiums directly to Medicare. SCAN is not going to charge you any premiums or any deductibles or any co-insurance. There are some co-pays here and there that we're going to discuss that in a few minutes, but there is no premiums related to your insurance. There is a premium of $148.50 that is paid directly to Medicare on a monthly basis. But from us, you're not going to receive any billing whatsoever. Medicare has 4 different parts, A, B, C, and D. A is the part that covers your inpatient hospital cost. If you need to go to the hospital for some kind of emergency or any medical needs, you are going to be using Part A, and it has no cost. It's zero copayment with Medicare and with SCAN as well. Part B is everything that has to do outside the hospital, like your doctors, your MRI, your CAT scan. This is the one that is costing you the $148.50 on a monthly basis. Part C is when you combine Part A and B, gives you Part C. So Part C ends up being SCAN. SCAN is also an HMO. It's also called Medicare Advantage. The advantage of you joining a Medicare Advantage or SCAN is because we're going to cover you 100%. We're going to combine A and B to become C. That way you don't have to pay any deductibles or any other out of pocket to Medicare. Because if you leave just the A and B alone, then Medicare is only going to cover you 80%. This is a common mistake that happens on a regular basis, especially during the open enrollment period that starts in October. We meet a lot of people who left their part Medicare, original Medicare, Medicare only A and B, and then they realize that when they go to the hospital, they have to pay 20%. So that's the reason why many people want to come and join an HMO plan or SCAN or Medicare Advantage, because that way you don't have any 20% deductible. Everything will be covered 100%. This is besides the $148.50 that you're paying every month to Medicare. Also, Part D has to do with your pharmacy. We will give you all the letters A, B, C, D, everything under one umbrella, because if you just leave the Medicare only or original Medicare, your pharmacy is going to cost you about $35 to $40 a month if you just leave your Medicare alone. So keep in mind that this is mandatory. I was talking to a gentleman yesterday, and he said, oh, I'm just want to leave my Medicare alone, and I just want to go to the pharmacy and pay my co-payments. And I say, you need to understand that besides paying your co-payment, you also need to pay a monthly fee, a monthly premium in order to have access to the pharmacy. And if you don't, you will be facing a penalty. So this is very important, whether you come to SCAN or you just want to decide and have a supplemental plan, you need to have it, whether you take medications or not, because otherwise Medicare is going to count the months that you went without having your Part D, and they will send you, it's called late enrollment penalty. It's not a big penalty, but they start counting the months that you went without a pharmacy plan. So don't confuse by going to the pharmacy and getting your prescriptions and paying a copay. This is different. This is a pharmacy plan that you need to get on your own. It's called PDP, prescription drug plan. Okay, now let's move on to the next slide. Like I mentioned already, SCAN is an HMO plan, or what is also called Medicare Advantage. Now let's talk about for those folks who are turning 65 or turning 65 in the next few months or maybe next year, or if you already turned 65, you have 7 months to join Medicare. You have 3 months before your birthday, and you have the month of your birthday, and you have 3 months after. So this whole month and every single month, I keep talking to the newbies, to the new folks who are becoming Medicare eligible. You need to call the Social Security office right now. And usually you make your interview over the phone, because the offices are, I don't know if they're still closed, but many of them were closed during the COVID. And therefore it was a little bit complicated, but thank God now things, offices are opening now, but you can still do it over the phone, or you can go on the internet to the website and you can join Medicare. Again, it's mandatory. You have no choice, but you need to do it if you don't want to face any penalties. The enrollment, open enrollment, It's which is called the when you become eligible for Medicare. It goes from January 1st until March 31st. This is to apply for your Part B, or if you're turning 65, you have 3 months to join Medicare. And after April 1st, there is no more switching or no more changes. In October 15th to December 7th, we have what is called AEP, Annual Enrollment Period, and you can make as many changes as you wish. You don't have to check with anybody or call anybody. If you're not happy with the plan that you have at the current time, then you can call. We send a lot of flyers in the mail. You can call the company that attracts to you. You watch TV, you see a company that is of interest to you. Scan does a lot of advertising on the paper or on the radio and TV. If you're interested in Scan, you can call from October 15th to December 7th. If you are happy and you're a Scan member right now, or you have another plan and you're happy with your plan, you don't need to make any changes. You leave it alone and you don't have to do anything. It will just roll over to the next year. Now I want to head into the benefit highlights. Okay, now we're going to be talking about Scan Classic, which is our most popular plan. This is Scan Classic. And here, as I mentioned before, we're going to look at Scan Classic, the one that I'm highlighting. There is also Scan Balance for those folks who had diabetes. As you can see, there is no difference between these three plans. Scan Prime is for folks who have other medical needs and you carry a premium of $25 a month. But if you have, say, major dental work or vision, ophthalmology, chiropractic services, this is a good plan for you if you need hearing aids. But for the most part, Scan Classic is the most popular plan, and Scan Balance is the plan for diabetics, only because your insulin comes at very reasonable prices. So we're going to discuss that in a few minutes. So let's begin with the plan premium. You don't have to pay Scan any money at all on a monthly basis. The plan is going to cost you $0. There is no deductible. And now we're going to go into comprehensive care. This is your Part B, which is the one you pay $148.50 to Medicare on a monthly basis. If you go to your primary care physician, PCP, you don't pay anything. It's a $0 copay. If the doctor sends you to the specialist, you also have a $0 copayment. Say you need to have eye surgery and your primary care physician sends you to the specialist, say the ophthalmologist, that whole entire surgery is going to cost you $0 as well. Then for those folks who are diabetic, even if you don't have diabetes, your supplies for diabetes will cost you $0. You don't pay for the lancets, you don't pay for the test strips, you don't pay for the monitor. It's completely $0. The annual physical exam is also $0. Preventative services like a colonoscopy or mammograms, you do need to have an authorization from your primary care physician. He sends you to get all these MRIs, CAT scans, all these preventative services. Then you pay $0 as well. Lab services and x-rays, you pay $0. If you need to get a diagnostic test for, say, osteoporosis or any other diagnosis, you pay $0. If you need physical therapy, occupational therapy, or speech therapy, it's unlimited, a $0 copay. For the CAT scan, ultrasound, MRI, it's also $0. And if you need durable medical equipment like a walker, if you need crutches, if you need oxygen tank, even if you need a medical, like a hospital bed, the medical group will provide this at no cost. What's a medical group? The Scan is the insurance company. We work directly for Medicare. We receive all the funding from Medicare, but at the same time, Scan has to work with many providers because they are the ones who are going to be treating you. So we work with medical groups. I'm sure you heard of FACE in the past. You've heard of Healthcare Partners, which is called now Optum Medical Group. You've heard of Regal Medical Group, Lakeside Medical Group. These are the most common here in the San Fernando Valley. And so when you go and see your doctor, your primary care physician, this doctor is going to be contracted with a medical group, because the medical group is the one who's going to pay the primary care physician. They're going to be paying the specialist. They're going to be doing all the approvals. So when you go to the primary care and then he sends you to a specialist, usually you hear like, well, we have to wait for the medical group to approve the referral. That's what they mean. The medical group, either FACE, Lakeside, Regal, Optum, they need to send a referral. So we get the money from Medicare. With that money, we pay the medical group, and the money that the medical group receives, that's the medical group paying everybody, paying all the providers. So we don't really pay the primary care physician, especially the hospital. We pay the medical group, and the medical group will be taking care of all the finances. Let's go to the next slide. Now, Part A, remember the beginning, I said that Part A covers all the inpatient hospital care, skilled nursing facility, outpatient surgery. This is your Part A, which doesn't cost you anything, is zero copayment. Now, say you need to go to the hospital and you need to stay there because something happened, God forbid you had an accident, or maybe you had a mild heart attack, a stroke. You go to the hospital and you go there for 1 day, 10 days, 30 days, 60 days. This is going to cost you zero. There is no copayment whatsoever, and it's unlimited. Now the doctor says, well, you need to go to a skilled nursing facility. This happens, say, when you had, say, knee surgery and you need to have a few days to recover. The doctor's not, the orthopedic surgeon is not going to send you home. Usually he's going to send you to a skilled nursing facility, because this is the place where he's going to go and check you out. They're going to be transitioning you from the hospital to the skilled nursing facility to your home. The doctor is not going to come to your home, but he's going to go to the skilled nursing facility to check you out. So for a few days, you need to stay there. A lot of people don't want to stay there. They don't want to go there. They just want to go home, but it's depending on what the doctor prescribes. If he tells you need to go, you need to go, but at least you have 20 days that you can go to the skilled nursing facility and it won't cost you anything. It will be zero. If you need to stay there from days 21 to 100, you pay $50 a day. Okay, so now let's go to outpatient surgery. Outpatient surgery, we were talking about you going to the primary care physician and he sends you, say, to the ophthalmologist, who is the specialist, the eye surgeon. You need to go and get cataract surgery, or you need to have some other kind of, any eye surgery that, it's been bothering you. And the doctor said you need to have outpatient surgery, meaning you go in the morning, you leave in the afternoon, you don't spend the night in the hospital. This is going to cost you zero. Cataract, glaucoma, all these surgeries will cost you zero. Now you go to the emergency care because something happened. And if you go to the emergency care, you go to the nearest hospital near your house or where the emergency happened. So you're traveling in Arizona and you're visiting your children, grandchildren, and you had an emergency in Arizona, you're in Mexico, you're in South America, you're in Europe. You can go to the emergency room anywhere in the world and you are covered. It says here $90 worldwide. It will cost you $90 if you go to the emergency room and you stay there for 4 or 5 hours. After 4 or 5 hours, the doctor says, oh, well, Mrs. Jones, you're good to go. You can go home now. You're out of any risk. You don't have to be admitted. Then you just pay a flat fee of $90 and then you go home. But say you had maybe a major accident and then you need to be admitted. The doctor says, I'm sorry, Mrs. Jones, I need to keep you overnight for further observation. I can't let you go home. Then that $90 becomes zero. You don't have to pay anything. It won't cost you anything at all. So remember, if you stay there for a couple hours, $90. If you spend the night, it's zero. Now, urgent care is also zero copayment. It also covers you worldwide. A lot of countries don't have urgent care. Usually they have emergency, but not all countries have urgent care. But in this country, everywhere in every state, there's urgent care. So a lot of people, we panic. I panic myself if there is an urgent situation, but we have the tendency to go to the hospital. And what happens is that when you go to the hospital, it was not really an emergency. It happened to be an urgent care. So we highly recommend to use judgment because urgent care is not going to cost you anything. So if you feel that it's maybe a migraine, you have the chills, you have a high fever, and you know you're not going to die from this, chronic or this sudden situation, sudden emergency, and you can handle it, we highly recommend that you go to the urgent care because it's going to be zero. But if you really feel that you have a major heart attack, you had a major accident, you fell down, and you can't get up and you feel that it's an emergency, of course you can go to the emergency because you are covered. Now say you're home and you fell down and you call your neighbor, nobody answers, you end up calling 911 for an emergency. The ambulance is going to come and it's going to cost you $200. So from these benefits, from the ones that we discussed on Part B and all these benefits here, everything is zero except for the emergency and the ambulance. If one particular year you don't go to the emergency room and you don't call the ambulance, the plan is costing you zero. Okay, so just keep that in mind. A lot of people get confused with the annual maximum out of pocket, the MOOP, maximum out of pocket, it's $799. So say one particular year you were very sick and you called the ambulance 5 times because every other month you had to call the ambulance because you didn't feel well and you had to go to the emergency room. So 5 times, 5 times 200 is $1,000. And you also went to the emergency and you stayed there for a couple hours. So you went to the emergency room 5 times as well. So that's $450. And this is $1,000. So when you add 1,000 plus 450, that's 1,450. So you pay the first 799. Your responsibility is 799. And then after that, you're not responsible anymore. So the difference between 1,450 and 799, SCAN will pay that difference. You don't have to worry about it. So that's what it means. Your maximum out of pocket is 799. This amount between ambulance and emergency can be 1,500, 2,000, 3,000. Between these two, you're only responsible for the first 799. Everything else is not your responsibility. And because remember, you only have 2 co-payments, the ambulance and the emergency, because everything else is zero. Okay, I hope you understand that because it gets a little bit confusing for some folks, but I hope you understood that part. Now, remember that we were talking about pharmacy. This is the pharmacy plan, which is also called Part D. That comes with a SCAN plan. If you decide to have your Medicare with a supplemental insurance, remember that you need to get a separate Part D that will cost you a premium on a monthly basis, besides the co-payments that you're paying here. Okay, but when you join SCAN, you don't have to pay a premium, you don't have to pay a deductible. It comes with a plan of zero cost to you. Now, Medicare tells every single plan that they have the freedom to impose co-payments for medications. And so every company is allowed to put any co-payments related to your prescriptions when you go to the pharmacy and pick them up. For instance, we work with 2 different kinds of pharmacies, preferred and standard. The preferred means we have a very strong contract with that pharmacy. Standard means we don't have a very good contract with that pharmacy. That's why a lot of folks call us on a regular basis saying, how come I ended up paying $7 at Walgreens? And then you told me that my copayment was going to be zero. So to clarify, preferred pharmacy are the chain pharmacies that are very popular when we drive around: CVS, Costco, Walmart, Rite Aid, Ralph's, Vons, Pavilions, all of them except for Walgreens. We don't have a very strong contract with Walgreens. Therefore, you're going to pay a lot more money when you go to Walgreens. So if you go to a preferred pharmacy like CVS, Rite Aid, Costco, and you are diabetic and you take metformin, which is a tier 1 medication, it's a generic medication, you are going to pay zero at all the pharmacies I mentioned. But if you go to Walgreens or a small mom and pop pharmacy, usually they're in the lobby of a big medical center, those pharmacies are not really contracted with us. Some of them are, some of them are not. So in order to avoid any surprises, I recommend that you go to the preferred pharmacies, because say if you go to CVS here to pick up your metformin is zero. If you go to Walgreens, you're going to be paying $7. There are also tier 2 generic medications that even though they're generic, they still carry a small copayment of $5 for 30 days. If you go to Walgreens, that same medication is going to cost you $15 for 30 days. So remember, don't go to the pharmacy that is not contracted with us, or it's a standard pharmacy, because it's going to cost you a lot more. So say, for instance, you go to CVS to pick up your metformin for 30 days. It is highly recommended to start asking your doctor to give you a 90-day supply, because not only that you're saving time and gas going to the pharmacy every 30 days to pick up your prescription. If you go every 90 days, it will save you more trips to the pharmacy. It will save you more money. Why? Because if you pay $5 copayment for a generic medication like metformin, then if you order for 90 days, or your doctor will give you a prescription for 90 days, $5 for 30 days, $10 for 2 months, and $15 for 90 days. Then what happens is that we're going to give you a month off. So for 90 days, you just pay $10. Okay, $10. Now we're going to be talking about members or patients who are diabetic and they use insulin. The insulin is a tier 3 preferred brand medication, and is going to cost you $25. And then other drugs will cost you $37. Okay, so now tier 4 non-preferred drugs will cost you $95 for just 30 days. If you multiply, say your insulin, if you're diabetic and you're paying insulin on the classic plan, it's $75 for 90 days, 25, 25, 25 is $75, but we're going to give you $20 off. So in reality, instead of paying $75, you're going to pay $55. Okay, so it's always better to order for 90 days. Now, let's go here to the balance plan. Remember the beginning, there was no difference between the scan and the balance. Everything was the same co-payments, but now there is a big difference, because if you join the scan balance under Optum Medical Group, which used to be Healthcare Partners, and if you use insulin, your insulin is going to cost you $0. Okay, $0. Now, you have other prescription drugs that are under tier 3. Say you're taking another medication that is a brand medication, you're going to be paying $30 instead of $37. So here you pay $30 for 30 days, but if you get it for 90 days, it's 30, 60, 90. We still give you the $20 off that we're giving you here, but instead of paying 90, you'll be paying 70. So we're always trying to save you money. So here, remember 25, 25, 25, 75 minus 20, you pay 55. Here you pay $0 if you're diabetic and you join the scan balance under Optum Medical Group. And then here, remember 90 minus 20 will be 70. So it always makes sense to order for 90 days. Now we have other tiers, $95 for tier 4, and then tier 5 for specialty drugs like cancer medications. We also try to work with other private pharmacies that will help you with this 33%. They're called specialty pharmacies, and we'll try to work it out so you don't have to pay that 33%. Now we have a dental plan that we have a small little package that we'll discuss in a few minutes, but we also have another plan, a dental plan that you pay $10 a month for the Scan Classic or with the Scan Balance. And this, you will be paying $10 every month. This is the only time that you're going to be receiving a bill from Scan, $10. When you go to the dentist and you need a crown, say, I don't have the plan, the crown is going to cost me $1,000. But because you joined the dental plan, instead of paying $1,000, you pay about 40 or 50% co-payment. So you pay about $400 to $500 plus $10 every month. Okay, so which is better to pay this $400 or $500 for a crown than paying cash $1,000. And it's usually not only a crown, but maybe a bridge or 2 crowns or 3 crowns. So this will save you a lot of money. This is optional. You don't have to get it. Now let's go here to these benefits that we're going to be discussing in the next few minutes. All these benefits are given by Scan. This doesn't come from Medicare. If you decide to leave your Medicare and join a supplemental insurance, or leave your Medicare only, or have original Medicare, you don't qualify for these benefits because this come only from Scan. And you don't need to have an authorization to use any of these services. You do it yourself. So you receive a book in the mail, or part of your application, you get information in the mail, and then Scan tells you that you have coverage for optometry, that small little package for dental, and so on. You do this yourself. You do not ask permission to your primary care physician. For instance, you feel that your glasses are not really working, your eyes are not as good as they used to be, and you want to see the optometrist. An optometrist is not an ophthalmologist. The optometrist is when you go to lens crafters and they're going to do an eye exam and they're going to do a prescription, the optometrist is going to send you glasses. The ophthalmologist is the one that we discussed before when you need cataract surgery, or you have any other eye issues and you need surgery, cataract or glaucoma and so on. Here is optometry that you can go to lens crafters, you can go to America's Best, you can go to Target, and you want to get an eye exam, you pay $0 once every 12 months. The optometrist tells you that your eyes need to get a new prescription. Your eyes are not so good, and then you need to get a new prescription. You pay $30 every 24 months. $30 could be more because we don't know how bad your eyes are. Maybe you need glasses that you need to have the glare, semi-glare, or so on, whatever you choose. It's $30 minimum, and then it can go a little higher. But if it's more than $30, the plan will give you a discount if you need any additional services besides just the prescription. The coverage for frames or contacts, which also includes contacts, is $175 that we're going to give you to buy new glasses or contact lenses. This is not a copay. This is free money. This is $175 in your pocket to get frames. If you go to Lens Crafters, you go to Target, you go to America's Best, and you want to get new frames, and the new frames are $200, then you just pay the difference of $25. Okay, so remember, the eye exam is $0, the contact lenses or the new prescription is $30, and then the frames are $175 that we give you. You already have $175 credit. Now we are going to be talking about dental services. I mentioned that we give you a small little package. It includes dental exams. You have $0 copayment, and you have 2 visits per year at no cost. The cleaning, you have 2 visits per year for basic cleaning, and you have 1 deep cleaning per year, okay, per quadrant. You need to go to the dentist that we're going to assign to you. Cannot go to the dentist that you've been going for the last 10, 15 years. And this is an HMO dental plan. This is not a PPO. And so a lot of people call me on a regular basis and said, Monica, I went to my dentist and they told me that they don't work with scan. Assigned to. And so if you were going to your regular dentist, you need to find out, hey, Dr. Smith, do you take scan? Do you work with scan? Do you work with Delta Care USA? You need to double check, okay? Now, this is free, this is $0. And then remember the other plan will cover everything else. Will cover the crowns, the dentures, covers everything with a $10 premium and also with the co-payment, 40 to 50% of any major work that you need to get done in your teeth. Transportation, we give you 24 one-way trips a year or 17 one-way, one-way 24 or 12 round trip. A lot of people, their husband or their children, the neighbor can take them to the doctors, but they can't bring them back. Then that counts as a one-way trip. But this one, 24 per year or 12 round trip. Most people do the round trip, the 12. And it renews every year. So every 12 months, you get 24 new or 12 round trip. You also get acupuncture, chiropractic, and therapeutic massage services, $15 per visit. And you have a 30 visit limit per year, acupuncture, chiropractic only. For those folks who have the balance plan, they have coverage for therapeutic massage services. No, I'm sorry. The co-payment for the scan balance is $5 and they have unlimited visits. They just pay $5 and $15 per visit for the folks who have the classic plan. At the beginning, I told you that we had the plan, the scan prime that you pay $25 a month. These are for those folks who have to go to the acupuncturist and the chiropractic on a regular basis. You pay $0 for the visit. Remember, you're paying $25 a month. Now you don't have to pay the $25. You pay $0 and you have 20 visits combined per year limit. Podiatry is your foot doctor. You have 6 visits per year for routine like nail cutting, clipping. All the plans, scan prime and scan balance also cover 6 per year. Podiatrists are also MDs. They're doctors. They go to medical school and they do surgery and they do major treatment. If you have an infection on your toe, your nail got infected, he can also treat this as well. He will send your primary care doctor. You tell the primary care doctor to send you to the podiatrist. And if it's necessary to do surgery, they will do it at no cost. It won't cost you anything. It will be $0. Okay, keep that in mind. This is for routine nail clipping, but if you have something major, some kind of infection or surgery, it will be covered also at no cost. Hearing services, they range from $450 to $750 per aid per year. And scan balance also covers the hearing aids. Here under Scan Prime, you pay $200 to $400 per aid per year. Okay, now we are going to talk about telehealth. It's not going to cost you anything to talk to the doctor over the phone or through video. Generic Viagra for those folks who are interested in getting Viagra 4 times a month, once every week. You are allowed to get it at no cost to you. Scan on the go. You have your benefits wherever you go. You will be covered, like I mentioned at the beginning, for emergency or urgent care. Travel assurance, this is very, very important because when you go to any other state, any other county, any other country, you will be covered for travel assurance. We highly recommend that you call Scan and let them know that you're going to be traveling. And that way you will be covered 100%. It's unlimited coverage. We will also give you health club membership. It won't cost you anything. Silver Sneakers will be coming here to cover you for any gym membership that you wish, anywhere in the country, anywhere in the state under Silver Sneakers. Over the counter, we give you $30 allowance to get items over the counter. Every 3 months, you have $30. So that's why you have here OTC, over the counter, $30 to get vitamins, to get anything you wish with the catalog that you're going to be receiving in the mail. The Fitbit, it's a bracelet that is going to help you maintain your activity level. And then you can count the steps and how many miles you run on a regular basis, or you walk when you go to the park, or when you go to the gym. We give you this at no cost to you. You just call scan and say, can you please send me my Fitbit, my fitness tracker, and it will be zero co-payment. You don't have to pay at all. And then here we go to the scan story really quick. For Scan Classic, as you can see, we have the respite care services, scan returning to home, and then emergency response system at no cost to you, which means that if you have someone at your home who's you feel very sick, and you have someone, a family member, your spouse, taking care of you, and nobody's paying, the state is not paying that person to take care of you, we can send someone to your house for up to 40 hours per year, for our minimum, to help you out. This is free of charge. Scan returning to home, it happens. This is extra help when you come from the hospital and you were discharged from the hospital, and then you still have, you need somebody to come to help you, a relative or someone, anybody can come and help you, 4 hours minimum. We can also allow that. So you get the 40 hours per year plus the 40 hours for our minimum that we offer returning to home. And the last but not least, we have the chronic condition meals from a discharge from the hospital. When you go home, we give you meals for 30 days, actually 28 days per year. And this is free of charge. You get free delivery to your home, but you do need to call scan and say, I will just discharge from the hospital. My representative, Monica, told me that I qualify for free meals. And then emergency response system. This is true of what happened. It happened yesterday. We give this emergency response system. It's a pendant, like a necklace that you wear around your neck or in your pocket, in your purse. And it's free of charge. You call scan and say, can you please send me the emergency response system? And then we send it to you at no cost. There was a lady who called me the last month or so. She's been wanting to activate her emergency response system. And finally, she had it done. She went through the process. Somebody from IT helped this lady from SCAN, help her activate the emergency response system. So everything was fine. She called me yesterday, literally called me yesterday at noon. She said, Monica, I just fell down and I broke my hip. And she said, I pressed the button, and then the button contacted my neighbor, and then my neighbor contacted 411, 911, and the ambulance came to pick me up, and now I'm in the hospital. And because of the emergency response system. And I couldn't believe it. This happened yesterday. So try to take advantage because it's free. You need to do the installation. The IT department from SCAN will help you set it up. And believe me, it pays off because it paid off with this lady yesterday. Okay, I think I'm done. I'm going to tell you that I have finished my presentation. I have chat here. Somebody maybe has a question, and I'm going to see if here, everyone, feel free to type questions in the chat. I don't see any questions right now, but let me know if somebody is available here to ask me any questions.
Also, everyone, you can also raise your hand. There's a feature at the bottom part of your screen that allows you to raise your hand, and you can verbally ask Ms. Monica a question. And there's also a Q&A section at the bottom part as well if you prefer to type a question.